Hello beautiful people, welcome back to my YouTube channel. In case you are watching me for the first time, my name is Ann Mruka, and welcome back to my YouTube channel, welcome back to my nursing channel. And today I want to talk about FGM, female genital mutilation. I don't know if I've pronounced it the right way, but I think that is how it is being pronounced, or according to your nursery school, whichever. Have you ever asked yourself why the government is against FGM and even across the world? Have you ever asked yourself? Because it doesn't have health benefit to a woman or to a lady or to a girl. So today I will show you some of the complication, immediate complication and long-term complication that might arise when you are a candidate of female genital mutilation, when you are a candidate of FGM, or if your culture is practicing this female genital mutilation. Let's get into the video. So let me start by defining what is female genital mutilation, that is FGM, and then I will discuss about the types, because it has 4 types, and then I will discuss about the complication. That is the main thing that I'm going to major on. So what is FGM? FGM involves, or it is cutting off the clitoris or the clitoral gland, the labia minora and the majora, and also it involves sometimes piercing and putting some incision around the genitalia of a woman. So that is how it is defined, or that is how it is, or that is how it can be so serious according to this definition. And sometimes it involves even the suturing of the birth canal. So the way I've said, it has 4 types: type 1, type 2, type 3, and type 4. Type 1 is the cutting of the clitoris plus the labia minora or the labia minora. It can be only cutting the clitoris, or it can be cutting the clitoris plus the labia minora or the minora, one of them. Type 2 is cutting both the clitoris, the labia minora, and the labia majora. Type 3, it involves even the cutting and creating a fold to close the birth canal of a woman. Yeah, that is type 3. Type 4, it is the harmful one. It involves cutting the clitoris, cutting the labia minora, the labia majora, incisioning, piercing, creating some funny things around the genital of a woman. And because this is harmful, the government and the WHO discourage this type of practice. I know some cultures are still practicing it, as they are hiding some of them, because if the government doesn't allow it, they do it under the water, and we know. But let me warn you, let me warn you, it is harmful for a lady. Even if it is a cultural practice, it is harmful for a lady. So the second thing that I'm going to discuss about is the complication, and I'm going to start with immediate complication that will arise when you are done for this FGM. Number 1 is excess bleeding. Obviously, that is something that will happen. You have been cut by something, even it is not, some of them are even blunt. You can bleed to death, I tell you. you can bleed to death. Number two complication that will arise is infection. You have been cut by things which are not even sterilized, things which are infected with, you don't know even where that thing came from. Infection will arise. Number three, fevers. Because of infection, you will get fevers, and that is very serious. Number four, swelling on that part that has been cut. Obviously, that part, it is very sensitive and it will swell. Number five, there will be damage of tissue around the genital, and it is very painful and it is just serious. Number six, pain, severe pain. Just imagine you have been cut with something without any, maybe doing what? I don't know how to call it. Without localizing that area, there will be pain. And the last one among the immediate complication is wound healing problem. So let me go straight away to long-term complication. Long-term complication, these are complications that will come after several years, after several months, after several time. These are complications that will come after several time, after this FGM. Number one long-term complication is difficulty in giving birth. This will cause obstructed labor during birth. Remember, the way I said, it involves cutting of the clitoris, the lambias, plus the incisioning, reducing the birth canal. So, in future, when a woman who involved in FGM wants to give birth, this woman will have problem during childbearing or when this woman is giving birth. Number two, urinary problems. Maybe sometimes when these people were doing this FGM, they interfered with the, when they're cutting the clitoris just beneath, on that clitoris there is a urethra, and urethra is where it can bring urinary problem, or you may have difficulty in passing out urine because they interfere with that part, or maybe you can have fistula. You can be passing just urine without, or you can pass urine without control. Maybe they interfere with the sphincters, maybe they interfered with the part of the urethra. So you cannot, the muscles itself, you cannot hold the urine. You can have difficulty in urinating, or maybe you can have frequent urination. Not infrequent urine incontinence. You cannot hold your urine. Number three, menstrual problem. You can have, during your menses, you can have difficulty in passing those menstrual blood, or maybe because they interfere with the birth canal, and that is where the menstrual blood usually pass. You can have pain during your menstrual period. This person also can have sexual problem because they interfere with the clitoris, and that is the sensitive part of a woman during sex. This person may sometimes suffer from satisfactory during sex, reduced satisfactory during sex, or this person during sex can feel pain. That is the serious part of it, FGM. Another part of it, another long-term complication that may come can cause psychological problem. When we were in high school, there was a girl who was done for this FGM, and this person could not bathe with us in those bathroom. This person, if she was just, and sometimes somebody can suffer depression, self-esteem reduced. She's not confident about herself because of this FGM. You just know the way people talk about it and the way government doesn't want it. So this person maybe sometimes can fear coming out to the public, even to address her problem. Another long-term complication is scarring and keloids. Keloids are those big scars that can come after a wound has healed. So this keloid can even interfere with this person during birth. Another long-term complication, and that is the last one, is vaginal problem. This person sometimes will suffer from itching that doesn't end, and also maybe discharge that does not end. So FGM is not allowed because it can cause serious complication to a lady or to a woman. That is why the government doesn't want it, and the whole world does not support it, because it has no health benefit to a woman or a lady. Thank you for watching my video. Let's meet in my next video. Bye.